Today we will be proceeding with the advances and some basic facts I would like to enlighten in this talk, in my introductory talk, where these are the days where we have seen in the 70s and 80s, we used to do the myelograms to identify the spinal pathologies. And this is how we have moved on. And then we have seen the CT scan, the emergence of MRI and then PET scan and things like that. And now we are talking about the navigation, we are talking about the O-arm, and we're talking about the robotic surgery. We all know this is a very famous book by Dr. Atul Gawande. 97% of the time, if you come to the hospital, everything goes well. But 3% of the time, we have major complications. And this is everyone, this is not a junior or a senior, but chances of having complication are less and less when you become a senior and expert, and they're more when you're younger. But this is where the technology will help us, and the still station, navigation, and O-arm is the future, where we are at least trying to aim at the accuracy, where we are doing the right precision surgeries. It is very important to understand that when we are talking about advances, you should have the basic concept. You should have understanding about the spine surgery, the anatomy, the science behind the spine. Because when you see sometimes the screw which is misplaced and hitting the cord, you always think what must have gone wrong. Is the surgeon is not doing it right, or something is going wrong? So for minimizing this thing, yes, advances are the future, and this is where we are talking about a lot of things. Like people talk about, oh, there is going to be a lot of radiation, but now with the newer versions coming up, there is significant reduction in the radiation, the precision, the accuracy, intraoperative scanning. Like we are doing any tumor surgery, you can definitely check with the O-arm, and you can see how much tumor is removed, how much tumor is remaining. This is the usefulness of O-arm. And I would just like to talk about this one basic slide where we all know about the Tesla. If you see this, it is revolutionized the concept of car and safety. The car which are like Tesla are like going like crazy. People want these kind of solutions because number one, if you see the driver is just sitting and it is navigated directly by the automatic machinery in Tesla. If you see, you are seeing the object, you are seeing when to stop, most of the things. And this is where the precision is coming. We are using cars, we are also driving cars. That does not mean that Tesla is giving something, but it is giving more safety and more precision when we are doing. And this is going to be the future. This is going to, because we used to use Nokia 3310, and today we all are using smartphones. Why? Because the precision, the beauty of the phone, a lot of things we can do, share, and things like that. That is where we always talk that we need to understand why these advances, why this precision, why this technology. Situations like deformity, cervical deformities, revision surgeries, prior fusions, congenital malformations, absent bony landmarks, complex malformations, difficult tumors, scoliosis. It's not that we cannot do this without technology. With expertise, with understanding, yes, you can do it. But this is making the, life more easier, more safer, and most of the difficult situations. And this is what we all should understand. If you see this papers will talk about everything. There will be pros and cons about technology, but the minimal access surgery and risk of misplaced screw, if you see, is reducing by the day. And we have to understand, it's not that we are using O-arm or robot. We need the C-arm at the same time. It's not that they're going to be obsolete. And we have to understand, as I already spoken about, that radiation exposure is one of the important things, which is getting lesser and lesser with the newer advanced O-arm and navigated machines. Limitation of human joints, if you see the hyperextension, flexion, and this is where we have limitation. But when the technology will be there, we will have 360 degrees movement with us. Minimally access surgery is going to be the future with less bleeding, less issues intraoperatively. And once we get used to this, we will start using it more often. That is what we always think about. Initially, there will be a learning curve, but once you start understanding, then it becomes very, very easy. Minimal scarring, smaller incisions, shorter hospital stays, less post-operative pain, faster recovery times. In case of spinal cord fractures, if we check with the O-arm, yes, we always check with the direct vision, but when you have the O-arm, we can check intraoperative whether there is any residual part of the compression, whether it needs to be taken out. At the same time, we can do that. In tumors, we can always check any residual tumor is remaining. In deformities, we can always be very precise when we are putting the screws in complex, difficult scenarios. All these things are going to be very, very useful. And these are the tumors, sometimes we feel I couldn't remove the tumor completely. And this is where this technology will help us of real-time 3D high-quality intraoperative imaging. When we talk about O-arm and navigation, these are all the important salient features because they always keep the database with them, and whenever you need, you can use it immediately during and after. At the same time, robotic also is coming big time with a lot of advantages in today's time. Disadvantage, if you think it's a costly machine, it's a costly investment, technically demanding, steep learning curve, and increased operative time in initial days. This is what is the experience of many who are using this now. And pre-op planning, this will already give you a good pre-op planning, and it will become very easy for most of you to use this straight away, where you will not miss, most important, you will not miss the accurate placement of the pedicle screw. Direction, orientation, all these things will be useful, will be used by the robot or the O-arm and navigation, basically the still station. All these things, this is what everyone will be covering today. I will not go into the detail as Dr. Guru Raj will be talking about robotic today, and this is where we will be looking forward. This is what is the most important thing, where the execution, with the experienced hand, you can execute difficult situations in a very good outcomes, and this is where the world is going to towards it. Tomorrow we want to talk about safe spine surgery, precision surgery, and this is where I will cut short my talk and would like to share with everyone's experience today. I thank you all for being there, and we'll start with Dr. Siddharth Iyer to share his screen for the evolution of technology. Over to you, Siddharth.